It is not just cancer treatment that is tricky, but also the post-care of a cancer patient. Cancer creates a lot of anxiety, depression, not only in the minds of the person who's going through it, which is the patient, but also the family of this patient. Today we have with us a very special guest, Samara Mahindra, who's the founder CEO of Carer. Welcome to Business World, Samara. So my first question to you, Samara, is that when and why did you start Carer? What triggered that thought of building something like Carer?
So I started the company late 2018. I've always been very interested in health and wellness. I knew I would do something in this space. Never thought in my wildest dreams it would be oncology. But unfortunately, my mother was diagnosed with cancer. And because I had this innate, just liking and curiosity when it came to health and wellness, I looked at her and experienced her cancer journey very differently to what maybe my siblings did. So I would notice that while she got access to great medical treatment, there was a massive gap in the cancer care spectrum per se. And while her doctors were phenomenal, her treatment was what we could get best in the world, and we were fortunate to get that. But non-clinical therapies, supportive care, personalized interventions, managing nutrition, managing her fatigue, her physical mobility, her psychological state of mind was something that we never were told about, it was never spoken about. And that eventually resulted in her debilitating to a very great extent, her immunity dropping and being suppressed to the minimum. And eventually she couldn't cope with treatment anymore. And unfortunately, she passed away. And that really led me into jumping into this entire industry of the medical fraternity and then oncology per se. So I spent a lot of time in the US. I understood integrative oncology, which is actually what we were looking for, which is a very scientific, proven methodology of treating a cancer patient. I also understood that India and countries like India still didn't have access to this. It was happening in all the developed countries, in the top cancer hospitals in the world. But unfortunately in India, even with all the, education that we had as individuals, we didn't even know that something like this existed. And that's when I saw an opportunity to work with the medical fraternity and, create a platform like Aero.
So Samara, you were talking about the gaps that existed when you saw your mother go through the challenge of cancer. What are the kind of gaps that specifically Carer as a platform addresses to bridge this that existed?
So number one is accessibility to experts. I believe that in India, the entire patient navigation structure is completely misaligned. Having access to the right doctors, to the right experts, to the right therapists is not as easy as one would require when it is coming to dealing with cancer. So Carer, first of all, fulfills that purpose. We create, direct accessibility to therapists who are trained in oncology. So whether it is a clinical nutritionist who has extensive training in cancer, or whether it is a physical rehab specialist or a psychologist. So we try to fulfill the accessibility gap that exists. Number two is, and I keep saying this, is engagement, knowledge, and education. This is where the root cause of cancer really lies, is because of the lack of knowledge and this is the lack of information and credible information. Cancer patients, caregivers, and those, just the general population in India have about cancer. It's completely misconstrued, and that's coming from just a space of lack of knowledge. So what we do is we empower all our patients, all caregivers, and anyone who wants to know about oncology through the right type of information, the right content, and educate them and empower them and enrich their knowledge. So we really focus on that by providing great content. We have a very rich content hub, and we really believe that by doing that, you're more or less solving a very big problem, which is the complete, fear that is associated with cancer, and then also what to do when you actually have cancer. So that's second. And third, which probably is the most important, is adherence. So unfortunately, when it comes to cancer and when patients are on cancer treatment or a certain drug protocol, the most of the times the treatment is the side effects are quite debilitating, and that really affects the adherence of treatment. It affects patients sticking to a treatment regimen, and either there is a delayed response, a gap in them doing the treatment on time, or even drop out and actually not continuing with the treatment is a very big problem. It's a big problem globally. It's a big problem in India. And that, again, is something that we address through multiple factors and parameters, one of which is just educating the patient. One is accessibility. The other is actually providing interventions that help with quality of life. Now, if we're there trying to support the quality of life of a patient, decrease the side effects of the treatment, the probability of them sticking to the treatment regimen is much higher. So that's something that we really focus on, is to give them not only guidance, but also implementable tools and therapies that they actually do on a daily basis. We actually assess it, we report it, and then we help them get through the side effects as well.
I think that's brilliant because, one of the things that really creates a fear in the mind of people is unpredictability. And, this unpredictability is because of the lack of correct information which is available to them at any point in time. So, they start running their own, thought process, which creates that fear. So that's brilliant. But Samara, tell me, what are some of the breakthrough treatments that the patients have undergone before they come to you for post-cancer care?
Right. So majority of our patients are on some drug intervention or some treatment protocols. So we don't actually come in post treatment. We are referred a patient as soon as they are diagnosed, and that's actually when integrative oncology kicks in, and that's actually when is the best time to provide comprehensive personalized care. Of course, we do get patients who have completed treatment and also come to us just as a post-rehab program, but that's a very small majority of patients. Now, we have had, the length of breadth of care has been pretty extensive and wide. We have worked with over 25 plus cancers, all treatment stages. And we've also worked with patients who come on different types of treatment protocols. Of course, the conventional ones being chemotherapy, radiation, surgery. Now, of course, immunotherapy. A lot of patients who are on, certain clinical trials also have come onto our program. Now, when it comes to the patient and the type of treatment they're on, or whatever their biological makeup is, or their background is, their lifestyle is, there is always an improvement in the patient when they come to our program. Because what are we doing? We're just supporting and providing interventions to help with their quality of life. So when they come to us, their quality of life is quite low, and we will always see an improvement in whatever type of patient. However, there are certain types of cancers and certain types of patients that respond much better than others. Now, patients have come to us even where doctors have written them off and said that, there is no treatment left for you and you need to just go back home and focus on your quality of life. And they've come to us at palliative stages and are still living. Now, I'm not saying the program that we do cures a patient, but there are many instances where patients are just focusing on quality of life, focusing on their nutrition, focusing on their immune system, and actually surviving very, very well, whether they have cancer or not. So in terms of the breakthrough kind of treatments that they've been on, it's been more or less, we've kind of touched upon any kind of treatment that a patient is on, because we work with so many types of cancers. But what we focus on is how the patient responds to our therapy, and what can we do best to customize and personalize it to that patient. And that's the way we move ahead.
Tell me one thing which is very interesting, what you told me. Does that also, in your experience, based on what you have seen among the patients who have come to you, have you seen that people with a stronger mental health tend to survive cancer for a longer period of time than those who are not mentally strong?
So that's a great question. And while there might not be uh, enough scientific evidence to show a direct correlation between someone's mental health and their ability to kind of respond to treatment or survive cancer, I have seen it time and again. My mother was a prime example. My mother had a type of cancer that the prognosis was maximum 1 year. She went on for about 7 years, and to such a degree where even her doctors just couldn't explain how she was responding to treatment. Now, one thing that my mother had was one of the strongest mental states of mind that any human being can possibly have, because she was one of those people who just was not letting cancer come in the way of her life. I see this time and again. I also have interacted with some of the top oncologists who have actually brought this to my knowledge, saying that, a lot of our younger patients, where their cancers are very treatable, earlier stages, but mentally they are just in a very, very, completely distraught state of mind. Maybe they feel like, being so young, they've been diagnosed with something like cancer. It's a very debilitating kind of disease that affects you on all levels. So the younger patients are not taking it very well mentally. However, in medical terms, the cancer is very treatable. In comparison to their much older patients who, probably whatever the reasons might be, are taking the diagnosis much better, and their cancer is much more progressed. And they have seen a difference, and they have seen that the younger patients are still not surviving, and they're succumbing to the disease as opposed to the older patients. So straight away you start understanding that there could be a correlation there as well, where your state of mind has some kind of direct link to the way you're responding to treatment. So yes, very much so. Not only because there could be just them being in a better state of mind, but even having a better state of mind helps with better food choices, a better immune system, being able to deal with the cancer, respond to the treatment better, improve quality of life, and all those factors could then eventually lead to a better outcome for the patient. So there are multiple ways to look at it, and there are multiple parameters that are involved. But does mental health play an important role? Probably the most important.
Awesome. So tell me one thing, in the last, if you look at 3 decades ago, the situation was that one, if somebody had cancer or something like this, the first choice was that if you could afford, you'd go to the western part of the world, right? What are the challenges that you see that makes India, different from the Western world, whether it is in terms of treatment or psychological effects? Where does India stand? And do you think that we are catching up and becoming as good, if not better? What are the challenges and strengths, in your opinion, that India has?
Right. That's a great question. So I have seen a profound transformation from just the time that I was a caregiver and dealing with a cancer, a family member going through cancer, where it was exactly what you said. The first thought was go abroad. And she actually got treated in the UK. She was all cleared, she was in remission, and then unfortunately it relapsed. And at that time, she decided, no, she wants to get treated in India. To today, where most patients are very inclined to sticking to their home country and getting treated over here. Now, just the pros and cons. Number one is the fact that cancer affects you on all levels. It requires a lot of effort from a patient and caregiver's point of view in terms of just getting the treatment, going to the hospital, accessibility to the hospital, the kind of side effects one endures. So you need to be in a comfortable environment, a place that is home, a place that is, easy to access when if you're getting chemotherapy in a hospital. So a lot of patients prefer, India. Second, the treatment that is available in India for cancer is as good, if not even better than what is available around the world. So it depends on type of cancer, the stage of the cancer, but. So I can't generalize, but we have some phenomenal oncologists over here. So today, the treatment that is available in India is at par most times. So patients are not getting secondhand treatment or anything like that when they are getting treated in India. Third is you want relatability with your oncologist today. Unfortunately, what I've noticed in the West, it's very cut and dry, black and white, and over here we have a lot more emotion, we have a lot more compassion to a certain degree, empathy, and we just relate better with a fellow Indian, basically. So it really makes a very big difference in a cancer patient's life. Now, we are still trying to catch up, of course. There are some phenomenal trials, phenomenal drug interventions, and new types of drug protocols being developed around the world. And of course, we are not there yet. But I don't see us, very far away today. The biggest example is integrative oncology. I mean, the reason that I even started Carer was because it didn't exist in India. And today, doctors, the medical fraternity recognize it, very strongly. And that's why we work with some of the best oncologists and hospitals in the country, because they realize their patient requires holistic, comprehensive, and personalized care. Cancer previously was treated as a symptomatic disease. The symptoms were treated and not really the person. Today, it's completely precision oncology, personalized medication, personalized treatment, and very patient-centric approach. And I can see India taking the leap into that as well.
So, Samara, one is a treatment. The other part that we spoke of, and you mentioned that, Carer does, is sharing of information.
Yes.
Right? And now, when you look at the conversations that happen around oncology per se and cancer in the layman's term, it is all about, what is it that you need to do in terms of, whether it's a surgery, then chemotherapy, and all the scary terms that come into your mind and, kind of create more anxiety. And also the conversation when the patient or the patient's family is having with anyone is trying to find out that how much life is left.
Mm-hmm.
The focus is on the end that somebody is seeing rather than on the living or the quality of living while you are living, right?
Yes.
So what do you think we need to do as a nation to create conversations that make people more aware and focus on the treatment and getting well than just surviving?
Yes. So, right now, if you look at most of the content available, when we Google cancer or oncology, majority of it is jargon to the just the layman, right? A lot of it is jargon to me. And what that kind of translates into is just, oh my God, I don't know what this means. Sounds scary. And that's just the common statement we hear all the time. So firstly, the content needs to be simplified, and communication needs to be simplified. Now, I understand and respect and acknowledge that a doctor has this much amount of time, and especially in a country like India, where the doctor-to-patient ratio is dismal, we can only, or doctors can only spend so much time with their patient to explain, to educate, to communicate. But in that little interim, it's very important the kind of communication, because that's their first point of contact and first touch point with understanding that they have been diagnosed with cancer. So you are kind of setting the benchmark per se and the foundation for now how that patient or that caregiver is going to react, and how they're going to absorb information. So I always urge oncologists, and I see this, there are some phenomenal oncologists who really start spending time, not really increased amount of time, but how they effectively communicate to the patient. Because when we were going through it, it was just complete gibberish, right? We just realize that it's something scary, it's life-threatening, and then that's about it. But today, I think the difference is made in the oncologist chamber, where they actually break the news to that patient and that family member or those family members, and then from there we need to have strong content hubs. We are trying to do it as Carer. I see some other companies also trying to do it, and it's encouraging, because you need to simplify the information. You need to create a platform or a hub where patients, caregivers can come to and really understand what's going on, not from a fear-induced state, but from a state where they can actually take action. A lot of the times it's this is what is happening to you, but it should transition to this is what now, what you can do now. That's the kind of communication we need to create. So it's simplifying what's out there. We need more people to talk about this. I mean, I unfortunately, even with my own family members, they'll not really go in depth with what's going on with my patients or what's happening in my company. They'll obviously ask me how things are going, but as soon as I go one step forward and let's talk about cancer, it's still very, I don't want to discuss this. But then when I realized that I make it more conversational, make it more actionable in terms of giving them things that they can do to keep their risks low. Or if it's a patient or a family member, just actually telling them that, hey, this is not as scary as you think. And there is things that you can do to, improve your life, then they listen. So even with Carer, just the tonality, the language, the color, and what is used in just our communication and our social media platforms and our website, it's not very clinical. It's not very, it's not very fear-induced. It's not very serious. We try to keep it light. These little nuances make a very, very big difference. So these are a couple of things that can be implemented.
So at Carer, I think one of the focus areas is nutrition for cancer patients. Yes. So how does diet play a key role in person's health and recovery?
Diet is the most essential component of anyone's life, to be honest. Now, I'm not going to say that's the only component, but it plays an integral part in how a person builds their immune system, how they assimilate nutrients, how how it affects their mental state of mind, and of course their physical composition as well. So when it comes to cancer, it is not a diet that you can pull off the internet. It is not an alkaline diet, ketogenic diet. I mean, we've heard all of it. It is a diet that has to be completely personalized to that individual. And what we actually focus on is a couple of things. One is obviously what is the medical standpoint of that patient? What is the kind of treatment protocol they are on? Second is what is the comorbidities of that patient? Is the cancer patient also, got hypertension or diabetes or so on and so forth? What is the lifestyle and what has been the lifestyle of that patient? Which what's their ethnic background, because we work with a lot of international patients as well. So we build an entire backstory and back history of what that patient and who that patient is. And then we prescribe and write out a diet plan. Now, another thing is that there is no standardization. So a certain food or certain nutrient or certain group of nutrients might be important and recommended for a certain type of patient for 3 months. But once the patient's treatment changes, or how they're feeling on a physical level, and how they respond to that diet plan, we will have to keep modifying it. So, and then the focus is gut health. That's where our immunity lies. That's where, like I said, we assimilate nutrients, and that's really food for our entire immune system. So I can't pick one food and say this is really good for you, and don't have this. I can definitely say that we have seen incredible improvements in patients just by tweaking their nutrition in a certain way, and actually seeing quantifiable improvements in how they're responding to their treatment, how they're recovering from it, bringing down their infection rates just because they are healthier, because their immunity has gone up, and how they're sticking to the treatment regimen. So nutrition is just imperative when it comes to anyone, actually, whether it's someone who's got cancer or not.
So, Samara, that brings me to a point, because there are two things that I understand from this conversation. Is one focus area is integration. So you have diet, you have well-being, meditation, as well as the appearance, right?
Yes.
And second thing you're talking of is personalization, right? How does it work? I mean, how is this personalization very different from something which is generally available? Because when you go to the internet, you have everybody who's sharing their experiences based on what they or their family went through.
Yes. Another great question, and it has taken us years to reach here. This has not been an overnight kind of success or overnight transformation of building something that is backed and proven by science. This has taken us time. So number one is that majority of our time spent when we first started Kero was to do a lot of pilots and literally like clinical trials with different patient types, cancer types, I would say, patient cohorts. So we worked with multiple cancer types, different patients, worked with some of the top oncologists, and we would just trial and pilot out our programs and just see how the patient is improving, where they're improving, and we would assess everything, and we used validated global assessments to measure, their nausea levels, their appetite, their weight loss, malnutrition, fatigue, all the major factors that really impediment treatment, and also sticking to treatment regimen and quality of life. Those are the things that we measured. And we did this continuously at the back end, and we gathered phenomenal data. And that data really now speaks for itself. So once we gathered so many data, thousands and thousands of data points and thousands of recommendations, nutritional guidance, and all the therapies we did, we started building out a protocol. And we started realizing that there is a certain pattern and a predictive, analytics kind of kicked in. And where we have reached today is somewhat over there. Of course, there's a long way to go, because the more data points you feed it, the more AI kicks in, and that's where digitization has played a role for us. So what we have done is, because we have built so many different protocols and patient profiles, we have embedded technology in what we do. And that takes us to about 60-70% of personalization. That takes us 60-70% of engagement, accessibility, and speed of treatment delivery and therapy delivery. But the other 40% is always with human intervention. And that's why I always stand tall on human touch and high tech. When you're working with cancer patients, you can never completely digitize the entire solution. Today, everyone's trying to build a technology company in healthcare, and I respect that and acknowledge it. But with oncology, you have to have a level of human intervention. So the second level comes in with the type of nutritionists that we have on board, their training that they go through, and then how their ability to personalize it further. So technology plays a very important role. The data, it all started with our data, brought in technology, and then with the finishing it off with a lot of customization through human intervention.
So tell us more about, since you're talking numbers, tell us more about the increasing cancer burden in India, And what, in your opinion, since you're working very closely with not just the patients but also oncologists, what do you think can be done to fight back?
Right. So now, when you look at cancer numbers in India, in comparison to, say, the US or globally, it's still quite small. So I'll give you an example. So in India, it's about 3 to 4 million cancer cases currently, with about 1 million new cases per year. Globally, it's about 18.1 million cases. In the US, if I'm not mistaken, 1 in 3 people will develop cancer or has high risk of developing cancer. In India, that's about 1 in 8 people. Now, what the worrying problem over here is that those numbers are rising rapidly. About 1 in 22 women in urban India will develop breast cancer, and that number is going up. So this can be related to multiple factors, sedentary lifestyle. So majority is lifestyle related, and that's something we need to understand. We have a wrong perception that majority of cancer cases is because of genes and genetic predispositions. That is not true. It has become more or less a chronic lifestyle disease. We have more women working in urban cities. There's a lot of stress. There's a lot of unhealthy eating habits. There is, so sedentary lifestyle, high fat percentages. A lot of the top cancers in India today, like head and neck cancer cases, cervical cancer cases, these are all can be prevented. Head and neck, it's mainly because of excessive alcohol consumption, smoking, chewing tobacco. So a lot of it can be prevented. Now, again, how do we fight back? It's education. We need to be able to educate just the layman about what cancer is and kind of mitigate the fear that is associated with it and fill it in with the right information. That's number one. The second, which I will always go back to, although Kera works and he works only with post-diagnosis, so with those who are diagnosed with cancer, I will always stand front for screening and prevention. That's key. We have to make screening a part of our lives. It has to become a part of our regimen, and it has to be something that is almost mandatory for individuals. It's just, you need to make cancer screening and a part of your annual health checkups, and that is when we can beat cancer. Cancer is curable if you get it early. If you get it, and the earlier you get it, the higher the chance of and probability of surviving it. It's as simple as that. If you give it too much time, as soon as it starts metastasizing, that probability comes down drastically. So you've got to start making, and this is where maybe the government can step in, where they start making screening methodologies and screening tests just a part of every human being's life in India.
Mara, since you're talking of prevention and you also spoke about the risks, what is the role that genomics is going to play? I mean, and I'm asking you from the prevention point of view as well, because the moment you think of genomics, the one thing is that are you high on probability of being someone who might have a cancer? Do you think that this is going to do more good than harm, or would it just create fear in the lives of people and create anxiety levels and depression?
Right. So this is my take on it, and I am not an expert in genomics, but what I can say is that, so we've had a lot of genetic companies who wanted to work with us because obviously they run their genetic analysis with the cancer patient's family members, right? That's the group of individuals who would probably want to quickly do this test or to see whether it's in their genes. Now, initially, I was very skeptical to kind of propagate this because of this whole having the person live in fear. So once you do the test, then what? You're told, okay, fine, you have this higher, like 70% chance of getting colorectal cancer. But then what? Then what are you going to give to that person to actually bring their risk down? And how do we keep monitoring? So my only skepticism was that while this is very important, what next? You can't leave a person like that, and they are not trained enough to understand what to do to bring their risk down. So that was one reservation. Having said that, it's still a phenomenal test to get some level of awareness, and then probably take the steps that one might have to take to bring their probability down. So it's kind of like pros and cons over here. There are some people who want to know. There are some people who rather not know. So it really depends on that individual. Again, I always propagate screening instead. Make that a part of your life. Especially with the new screening tests that are available that pick up cancers at such early stages, that it'll tell you whether you have it or you don't, and it'll tell you whether you have it at such an early stage that it's minimal treatment if required, minimal treatment cost, and almost 100% or 99% chance of survival. So I would still propagate that instead.
So what's next at Carer? What is that next big thing that you have in your mind that you wish to implement as the founder of Carer?
Oh God, there's so many big things I'm dealing with on an everyday basis. So when someone asks me that, it's quite overwhelming. But having said that, it's very exciting because we are, I think, at the right place at the right time. Finally, in India, where we are, have always stood by propagating patient centricity and personalized care. Now, today, the world and the country is looking at it. While we specialize in oncology, and while digitization plays an important role, I think we have found that beautiful marriage of human intervention and digitization to provide phenomenal therapies to our patients, and really see and quantify the outcomes, which I think all our doctors see all the time, and our patients and caregivers. So that's exciting. Having said that, the world is our oyster, and we are very keen to, finally transition and replicate what we've done in oncology to other disease segments that require this as well. And I would say more or less all chronic disease segments require it. But there are certain ones that I'm personally very interested in, which is not getting the intervention that is required for the well-being of that patient. And so soon, hopefully, sooner than later, we'll also step into other disease segments as well.
So Samara, have you raised external capital for your business, or do you have plans to grow, and how big is Carer right now, and where do you intend it to be?
I have raised external capital. We've kept it quite private, and have some phenomenal investors on board. We are building, I think, a world-class team, which I'm really excited by right now. People from some of the best in the fraternity are coming on board to take this to the next level. In terms of our team, we keep it quiet. So there's been a massive change pre-COVID, post-COVID. Of course, bringing in technology, the team size has come down, which is great. But we have quite a few members in the team that are there specifically to deliver the therapies, and then back end operatively, we have a good group of individuals who take care of the entire quality and the therapies per se. So if definitely going to be raising external round, we're going to be raising a much larger round, hopefully early next year, where we are then looking at massive scale. I think we kept and purposefully kept Carer very concentrated, very personal, small, intimate, because we are very focused on building data, building evidence behind what we were prescribing. Today, we have, I think, a pretty strong protocol that can be scaled in oncology for more patients, but also other disease segments. So that's what's en route right now.
Samara, my last question to you is that being a woman entrepreneur and being a founder of an organization, are there any challenges that you faced which were specific to you being a woman entrepreneur?
I've been asked this question so many times, and I have to be honest, it's been wonderful. I feel being a woman entrepreneur has actually helped to a large degree, especially in a very what used to be a very male dominated kind of industry today, of course, is a little different, but people are ready to listen. They're ready to at least entertain a conversation and hear what you have to say. So it's actually made it much, I feel that it's kind of expedited my journey and made it much easier. Where it has been an interesting paradigm shift mentally is also, as a woman, and that's something that I used to get before, is that, does this impede your personal life, or you wanting to get married, settle down, have a child? And before, I used to obviously turn around and not even think about that and say absolutely not. And today you look at your company very differently, and in fact it's actually helped propel me to build a stronger entity, because you start looking at your life very differently once you kind of settle down and have kids, where just what you bring to the table as an entrepreneur, as a founder of a healthcare company changes. And again, I can't really pick what that is, but just the way that the company is run, the way that you work with your employees, your entire team, the kind of delivery of therapies you give changes as you kind of grow older. And I don't know if that's just very woman specific, but it seems like that. So I think that would change, but not really anything else. It's been wonderful, actually. It's really been quite easy to kind of get into the industry.
So when you were talking of focusing also on appearance, was this something where you had a pushback, or you were misunderstood as to why this is a serious business? What you're talking of oncology. Why do you want to bring appearance in it? Did you ever get that kind of a pushback?
So we don't focus on appearance. We focus on the physical body composition of a patient. And that's, and so example, a lot of cancer patients, especially breast cancer patients, have a very high fat percentage. And that actually increases your risk. There's enough evidence to show that. So we focus not on external appearance. We've never ever done that. We focused on what is the best for that patient to make them healthy and to keep their quality of life, as high as we can. What we do, which I am very particular about, and maybe this is because of my own personal journey with my mother going through it. My mother was a very beautiful, physically beautiful person, and she was very, she was always well dressed, and she had the most beautiful skin and everything, and beautiful hair. And when cancer, when she started going through chemotherapy, actually it really affected her on a physical level. But of course, you lose all your hair, and everything that she would really love about herself, unfortunately, change because of what the treatment does to you. And we can't ignore that factor. A lot of women go through this, a lot of men go through this. So what we do is that we provide resources, we provide different kinds of, like example, we have in our content, we show patients how to tie a beautiful hair turban, and say that, just, it doesn't have to be morose, and it can look, and that's something I learned from my mother. She said, okay, fine, my hair's dropped off, but I'm going to wear the coolest, best looking hair, turbans that there are. And she did it, and she looked phenomenal, So something like that we can really empower a patient. How to manage your skin conditions is something important. How to draw your eyebrows. Now, a lot of cancer patients lose all hair, right? And they lose their eyebrows. They have no idea that, and most people don't have idea that that's okay, and we can actually just draw out our eyebrows, and there's a way of doing it. So these little things we definitely propagate, and whoever wants to learn can learn. If they're not interested, not interested. But what Carer does per se is very serious, in the sense that we're very data driven, very scientifically driven, and our results are very, we focus on outcomes, and we monitor and assess everything. And that's why we become a very important partner for an oncologist, because the end of the day is that their patient is much healthier being on our program.
So Samara, I think this has been a brilliant conversation, because I lost my mother to cancer. And I completely resonate with the care that these patients require. from the time they actually have been told that
Yes.
you have this health condition, you know. And I love what you are doing by simplifying, and you know, you have the strengths to bring that you bring to the table. And there was a reason why I asked you about a women entrepreneurship as well, because I think, you know, you're bringing simplified communication, which comes from your training as well, and your study. You are bringing in empathy, and I think that that you're being a woman entrepreneur and a woman leader for this initiative, I think just brings it more naturally than what a man could bring. That's my perception. And last but not the least, the integrated approach of medical intervention, nutrition, keeping people mentally strong. And also when you're talking about appearance, I mean, I would rather term it as building confidence.
Yes.
Empowerment. Empowerment. I think it's a brilliant, brilliant initiative. Thank you so much for taking our time to speak with us. We appreciate your time. I know we've gone beyond what was planned.
No, thank you so much. It's a pleasure. Thank you.